Coronavirus, COVID-19. This is a new illness that can affect your lungs and airways. Protocols. As we continue to navigate through this challenging time with the spread of COVID-19, also known as the coronavirus, the health and safety of CTR employees is our utmost priority. Actions to take to reduce the risk of COVID-19. Wash hands with soap and water for 20 seconds, multiple times per day, or use hand sanitizer if hand washing is not an option. Avoid touching your face, nose, and eyes. Practice social distancing of 6 feet from each other. Contact with other employees, such as a handshake or high five, must be discontinued during this time. Shared surfaces such as in the lobby, countertops, computers, doorknobs, microwaves, and coffee machines shall be properly cleaned after each use and prior to close of business. If applicable to your duties, make sure you wear PPE such as gloves, safety glasses, and respirators. Proper handling of COVID-19 situations. If a CTR employee is considered high risk for COVID-19 virus according to the CDC guidelines, the employee should notify his or her manager and discuss options available. If a CTR employee has COVID-19 symptoms outside of work, symptoms of a fever of 100.4 degrees or above, persistent cough, shortness of breath, or any other acute respiratory symptoms, the employee should stay home and contact their personal health care provider. Exhibiting COVID-19 symptoms at work. Employee exhibits symptoms of COVID-19 at work includes the following: a fever of 100.4 degrees or above, persistent cough, shortness of breath, or any other acute respiratory symptoms. Contact their manager immediately. The manager is to instruct the individual to go home. Once home, the individual is to contact his or her personal health care provider. Apparent respiratory distress. The manager must send the employee home and not send them to the emergency room. This is to limit the potential spread of the virus. In the event of a serious respiratory distress, call 911. COVID symptoms. The areas where the employee who exhibited COVID-19 symptoms will be cleaned and sanitized for after the employee has left. Employees who are potentially exposed on the job, the manager must communicate the potential exposure. Review preventive actions to take to reduce the risk of COVID-19. If an employee is in close contact, distance of closer than 6 feet regularly throughout the workday or at home, with an individual who has COVID-19 symptoms, they should self-monitor for symptoms of COVID-19. The employee is not required to quarantine unless he or she develops symptoms of COVID-19. An employee who is tested positive for COVID-19, the employee must not report to work, must notify his or her manager. The employee will undergo a 14-day quarantine period from the time the person who tested became ill. Tested positive for COVID-19. The health department may interview the positively tested employee to determine where they have been, who they have interacted with, etc. If deemed appropriate, provide guidance regarding quarantine, cleaning requirements, etc. Return to work. Employee is attempting to return to work after missing work due to symptoms of or diagnosis of COVID-19. Employees are required to submit a release to work note from his or her personal health care provider in order to return to work after quarantine. Travel-related, close contact with positively tested individual or other governmental quarantine mandates, etc.